are live. I love it. How you guys doing? This is Joseph and Casey, as the bottom of the screen says, of course. I'm here with another week of the pre-PT chat live. But before we begin, we're going to share this out so that we can begin with our conversation for tonight. Tonight, we're talking about different settings to work in as a physical therapist. This is going to be a good one for a lot of you that are still trying to figure out where you want to be as a physical therapist, but even better for those that are still trying to figure out if this is what you really want or not. So let's share this out, and then we're going to get cracking. What's up, Sarah? How you doing, fam? Good to see you.
What's up?
All right, guys, we're going to share this out. And if you guys want to share it out as well on your different platforms, feel free to do that so that people can see this, or your classmates, friends, anybody that you guys know that would benefit from just, learning about the different career settings and any other videos that you guys like that we have put up that have been beneficial to you. Help your homies out, help your friends out by sharing it out. But Casey, give us a little bit of an update how things have been with you before we get started.
Yeah, things are going great. As you can see, the light coming into the room, sunny California that I'm in right now. Did my midterm CPI today. I forgot what CPI stands for, but basically it's just a midterm evaluation of how physical therapy students are doing during their clinical internships. And I'm doing great. Long story short, doing great. Patients are great. And honestly, it's dope to be a physical therapist. Of course, not graduated yet, don't have my license, but just going through that whole process, having patients come in, doing evaluations, even down to the documentation, seeing the patients, asking you questions, knowing that they're trusting you and they see you as, they're, almost primary care healthcare professional. Oh, yeah. So it's really all the hard work from pre-PT to PT school. It's really paying off. So if this is what you want to do, if this is where you want to get to, don't give up. Don't give up, because if I gave up that first time, I would not be on this live video talking to you guys. I would not be in California right now. I would not be treating the 10 patients or so I treated today. It's just great. It's just great. How's everything going over there? Oh, clinical performance instrument.
Yeah,
Thanks.
CPI.
Appreciate it.
Everything's been great down here, unlike Casey, where he's in California and everything's sunny and bright. I'm here in Florida. It's dark. Now it is dark, which is what I'm used to at this time of night. But super excited. Super excited. I love Thursdays, but I usually get excited before we do these live streams because I know that there's a lot of pre-PTs that come on that have a lot of questions, want to understand more about their journeys. So y'all that are listening that are pre-PTs that are looking to push yourselves to become the best possible applicant you can be, we 100% commend you because if you're either in one of two places, you're either trying to kind of figure out whether this is what you want, or you've identified it and you're like, okay, like what can I do to put myself in a position to win and win big? What can I do to set myself up to do well? So for all of you, 100% commend you. Cody Wales, what's up, brother? How you doing?
What's up, Cody?
That was Casey's roommate, one of our homies as well. Good to see you. Also, Kyle Rice, man, it's good to see you, brother. It's good to see you. But tonight's topic is not going to be about mindset or not getting into physical therapy school. I know we talked a little bit about that last night when Greg and I came on live, and then when Casey and I did that live, a few weeks ago. But tonight we're going to talk about different career settings. I mean, different physical therapy settings, because a lot of you, that's the beauty of physical therapy, guys. That's the beauty of physical therapy. A lot of us, if you're anything like myself, come into the profession saying, you know what, I want to do this one type of PT. So for me, like a lot of other pre-PTs, I was like, yo, I love athletics. I love my sports. Let me do sports PT. It just kind of seemed like to make sense, right? It was the only thing I really knew. So it was only fitting that was my misconception. That was my small scale understanding of what physical therapy actually had to offer and what I could actually do in the field as a whole. There is a lot, guys. There's a lot of good things in physical therapy. You can pretty much fit anywhere on the spectrum in terms of personality, in terms of interest levels, in terms of driving points or what actually pushes you to excel. That you can, I mean, you can do whatever you want. Everything from hospital settings where you can see everything from a very, very, very acute setting to more long-term hospital stays, so like an inpatient rehab, and we'll talk about all this stuff, to home health, to outpatient, to, I mean, it's so much. And then on top of it, because of how much we've grown with technology, you have a lot of online therapy that's starting to grow, because there's a lot of medical professionals that have been using online to see patients, treat them, and all that stuff. So there's so much out there, and we're gonna hit it tonight. But if you guys are still trying to figure out, man, okay, can I see myself in this profession long term? You guys are at like you guys have a profession where you don't have to re-specialize. And by that I mean, like, you don't have to become, it's not like a physician where you're your primary care provider, but to become an orthopedic surgeon, you got to go for more schooling, or you got to do like, it doesn't work like that. You're a physical therapist and you can work in all these different settings, which makes it pretty cool. And if you see yourself in a position where you're not sure where you want to go, then feel free to just try one. And if you don't want to be there more than a few years, you have options. You can go from outpatients going, more inpatient, or more nursing homes and all that stuff. And Kyle, you're right. We need more engineers, mathematicians, artists, everything. Like, we have, and the thing is, like, this is so key. The thing is, this is the beauty of all this. The beauty of it is the fact that as pre-PTs, you guys are you're in an amazing position. You're in an amazing position where you have the chance to actually set the playing field for the next generation of just physical therapists, healthcare providers, period. Because you're at a point where you can help prevent and help people recover, where you can prevent people from actually, going down an invasive route or having to rely on medication, but you also have the ability to help them recover after injuries, surgeries. But you're like the glue that holds it all together. And when you guys accept that, when you guys accept the fact that you guys are the glue that holds it all together in the medical world, you will start to value your position as not only future physical therapists, but as the pre-PTs that are going to now come in and continue pushing our profession, changing it up. Because like a few years ago, who would have thought that PTs could see patients online, that the PTs could see patients virtually, that maybe a decade before that PTs could do A, B, C, D. Like, it has grown because someone came down the line and said, we could take our skill sets in physical therapy and actually use them for this given group of people. You know what I'm saying? Like, we always say, like, it was birthed from a nursing profession, right? Meaning that initially it was only meant to serve one group of people, whether it was at war or whatever. And over time, then other groups were added into that mix, where athletes were brought in, pediatrics were brought in, people, in acute care were brought in, like home health was brought in for people that could not leave home or were transitioning from maybe a hospital stay to more outpatient. But it took somebody like all of you to come in and say, okay, A, B, C, D has been done, but let me take my interest levels, let me take my passions, let me take what the holes that I see, and let me actually push it further. So that's the beauty. So tonight we're talking about the settings that are currently there, but also about what you guys can actually do to then set the playing field. Just broaden the playing field even more, because PT can do some amazing things, and I don't think we've come close to hitting the tip of the iceberg with what the profession can actually provide the world. Just remember, y'all are the glue. Y'all are the glue in the medical world. So, Casey, tell us a little bit about some of the career settings, some of the PT settings that are there that we as pre-PTs can hold on to and understand, and start to comprehend, so that as we set ourselves up, as we prepare for our interviews, we actually are putting ourselves in a position to win, and also sound intelligent, when we're going to our interviews and campus visits and all that stuff. So give us a little bit of a breakdown, Casey.
Yeah. So let's break it down into, clinical, then we can hop into non-clinical a little bit later because obviously we're doing some non-clinical stuff right now. So we can get into that a little bit later, but you touched on some great things in the clinical world of PT. So a few more things are like we can specialize in like chronic pain or, quote unquote pain specialists. Neuro rehabilitation, meaning, stroke, spinal cord injuries, Parkinson's, traumatic brain injuries, things like that. You already said pediatrics, amputees, like a lot. If you go into the military or work in a veterans hospital, you can do work with amputees as well. Wounds care. What's up, Carl? What's up, Carl? Wounds care is also another thing that many of you might have not known physical therapists do. So wound care is another one. Cardiopulmonary. There's a whole section on, shout out to Kyle Rice, on the NPTE for cardiopulmonary. Then, of course, acute care, geriatrics, TMJ. There are some TMJ specialists. Vestibular, meaning, everything going on in the ear and the balance system and everything like that. What's up, Maribel? I think we're meeting each other soon. In the area, Bay Area, California. Look forward to meeting you. What's up? What's up? Getting back here, women's health, pelvic floor, orthopedics. Then I think you were talking a little bit about wellness. We can get into that field as well. Along with, you said, sports, athletics. A lot of us go into that for that very reason, go into PT for that very reason. Then we get into like travel PT and home health and that whole world in itself. That's a whole live and that's a whole podcast series in itself. Home health, outpatient, then you can do some mobile PT, CrossFit. That's just, like you said, that's just breaking the surface, but that's just a short list of a lot of the clinical things that we can do as physical therapists that maybe you haven't known about. If there's any more, drop them down in the comments later on here live or replay.
Yeah, I actually want to hear, as we prepare to transition into even the non-clinical side of things, man, for those of y'all watching, comment below what areas of physical therapy have interested you, or what area of physical therapy do you see yourself getting into? Like what's drawing you right now? What's pulling you in? I already told you, like mine was like sports PT, because at that time I didn't have, individuals that were, introducing me to the different types of clinic settings. So if you are on here and you're a pre-PT, comment what type of setting are you interested in? What type of setting are you pulled towards? What type of setting entices you? Even if it's more than one, drop them below. So we have aquatic therapy, perfect. And even if you are a PT student or a physical therapist joining us live, like comment what yours are, like whether it's where you work, whether it's where you're an intern. Just drop something. Like let's see what all y'all are representing and what you guys are interested in, because that's what makes it amazing. So he says, what about physical therapy for pets? Couldn't that count for hours or something just unique that can be talked about in an interview? Yeah. Well, we got to bring the K9 PT in here one time. Boom. So one of our friends is like, his platform is called the K9 PT. And so he actually stopped treating humans. Now I'm telling you, like he does K9 PT now in Chicago and he's killing it. So we'll have to bring him on here live because I think that's another world of PT that would be absolutely amazing for a lot of you pet lovers and dog lovers and all that stuff to really appreciate. But yes, for sure. So we got sports PT. All right. We got a little outpatient ortho, sports med. Let's see. Yes, for sure. The K9 rehabilitation and wellness. Y'all check out the man's stuff. But we'll bring him in here live. We'll link up with him. We'll make sure that we come in live so you guys can kind of hear a little bit about that, especially if you love your pets. But yes, there are so many different settings. Embrace them during your observation hours. Try as much as possible to go into those, like especially if you have multiple locations or multiple settings that you are interested in. Don't just do observation hours for the sake of it, y'all. Like we said, there's a lot of different settings clinically, right? So if you're interested in in like 4 main settings. Make sure that when you're doing your observation hours, you're actually targeting those as well, because that gives you even more clarity as you're coming in. That for you, it's a personal thing. It's a personal thing where, one, your energy level will actually be a lot higher because you're actually interested in it. But two, it's for you to figure out, like, can I actually see myself doing this? Can I actually see myself doing this? I've had pre-PTs all the time that are like, man, like I observed at such and such a location. I became a tech at such and such a location. It actually led to me getting a job opportunity there, you know, whether as a tech or even down the line coming back as a physical therapist. You don't know what opportunities are going to be there. So go for what you can see yourself potentially doing. Now, might that change down the line while you're in physical therapy school? Yeah. Heck, that's where my viewpoints changed, because I was coming in sports PT, and then I got into PT school. I was like, wow, there's a lot of other areas that really are absolutely amazing. And one for me was actually inpatient rehab. Inpatient rehab, where for the first time I was able to see patients that were there for multiple things. We had a few people that were like there for amputations, and so they were getting some pretty high level stuff. We had patients that were like bilateral total knee replacements, but because they had other comorbidities, they were in there a little longer. So you're seeing such a drastic change in patients because they're there for, you know, sometimes a week, 2 weeks, even I've seen some there even more than that. And so you're seeing such a drastic change in such a short period of time, because you're seeing them like they're getting like 3 hours of therapy a day, whether it's between between PT and OT, like 3 hours of therapy a day, which is mind blowing. That's work. But because of that, you actually see so much change. You see someone going from being almost bedridden to walking out of the gosh dang hospital with a walker. It's amazing. But that appreciation did not come until later. So for all of you to see this now, for all of you to start understanding what the settings are, and Casey, if you could like repeat those again, but to understand what all the settings are becomes an asset to you, so that you can start highlighting, like make your list of what the settings are that you are interested in. Make your list of the settings that that draw you. Because if you can do that and say, okay, I'm actually interested in ortho, I'm interested in acute care, I'm interested in, like, identify maybe 4 or 5 of them that are really pulling you, and then shoot for them when it comes to observation hours, whether it's local hospitals, local clinics, like reach out to them. Even if you're not able to get all of the ones that you want, you'll at least get a majority of them. And that already puts you in a much better place. And then just throw yourself at the opportunity, throw yourself in there, show up, show out, go next level every single day, wipe down tables, ask questions, be involved. Don't ever let them feel as though you are a burden to them. Like, you should be, they should be wondering, because I know for a fact here at this clinic, there's certain pre-PTs that come in, and I'm looking at my boss, and I'm like, yo, can we hire this person? Like, that's how they should see you. That's how they should see you. That's how next level you should be. That they're like, yo, can we please keep this student? Can we employ them? Can they be a tech? If you're doing it at that level, then that's when you win big. So Case, could you give us a quick recap on what those settings are, and then we'll answer questions as they come.
Yeah. So your last question was really about what is acute care. Acute care is a fancy name, or not so fancy name, for hospital. That's really what acute care is. Then before you hopped on, Shay, we were talking about the settings in the clinical world. So I'm gonna breeze through them real quick for the people who've heard them already. So I talked about pain specialists, neurologic rehabilitation for like strokes, TBI, spinal cord injuries, pediatrics, amputees, wound care, cardiopulmonary specialists. Talked about acute care already, geriatrics, TMJ, meaning temporal mandibular joint, the jaw, vestibular, meaning ears and balance, gait, pelvic floor, women's health, of course, orthopedics, sports, wellness. Oh, I skipped over hand specialists. Then you can do travel PT, home health. Then we had a couple comments earlier about aquatic PT and canine PT, or animal care, however you wanna term that. So yeah, quick breakdown there.
Done. Perfect. Yeah, guys, this is where y'all are joining an absolutely amazing profession. There's a lot of options out there. Do yourself the service of making sure that you go and understand how to target the ones that you want, the areas that you want, because it's so broad. You can't just go to a random setting or a random clinic. I mean, you might like it, you might not. You know what I mean? Like, don't just shoot in the dark. Because your energy will come out when you go somewhere that you're actually interested in. And then that will leak out into everything you do during your application process up until the interviews. So identify those things. It's for those of y'all that commented, even those of y'all watching on replay, still do what the others did before and just comment what your preferred settings are, what settings are drawing you or pulling you that you'd be interested in. Comment them below. And then use them as, I mean, look at the comments that other people are putting up so you can say, oh, I actually didn't think of that, or that. Or I mean, some of y'all probably saw the K9 PT and were like, oh, I didn't even really consider animal PT. You know what I mean? But it's all there. It's all there. So that's how you guys can set yourself up to target, to shoot right for what you are interested in, and shoot. Worst case scenario is you realize, maybe I don't want to be in the hospital, or maybe I don't want to be in outpatient. But there's so many other settings that you really cannot lose. But at each setting, the premise is always going to be the same. Serve at a high level. Do absolutely everything in your power to ensure that everyone that comes in leaves so much better because they were in your care. And so be absolutely amazing, guys. Absolutely every single step of this journey as pre-PTs, as PT students, as physical therapists, because I say this a lot, y'all. I say this a lot. We need y'all. Andrew, that's amazing, brother. We need you guys in the profession. We need you guys in the profession. The profession needs you. We're not saying that just to say, we're not saying that just to, make y'all feel good or whatever. Like, we honestly believe that, that the profession needs you. It's amazing things are only one generation away from either going uphill or downhill. And that's why we want to always pour so much into all of you. Casey and I and our team we're not going anywhere. We're not going anywhere. We're going to keep pouring into you because we love the profession that much, and we love watching you all succeed at that level. So if you guys are like, man, like let's do this, then after today's talk, like go make a list of five settings that you'd be interested in, number them from your top one to your fifth one, and say, all right, if I gotta start setting myself apart, let me start targeting these places to observe. And then hopefully that leads into a job where you can become a tech or whatever, but just do it for yourself. Do it for yourself where you can really highlight, what you want, and just shoot right for it. Do we know anyone that does travel PT? Oh, show.
We know a lot of people, not just one
show. No, really, we do. Send us a message at contact@pre-PTgrind.com and we'll send you a few names.
We gotta drop some non-clinical knowledge on them too before we.
True. Did you guys know what settings you wanted to work in going into PT school, or did your mind change? Girl Sarah, I thought I was legit doing like sports PT 100%. I was like, yo, I want to work with athletes. I'm a Lakers fan, so it's my dream to work with the Lakers. Shoot it. You never know. But that was like my mindset coming in. And then once I got in, that's when I had a profound appreciation for the other settings. I actually was drawn to neuro for a good while. I still love neuro because of how I had to think through it. I thought it was absolutely brilliant and amazing. And so my appreciation for the different settings actually went up. And had I had that appreciation as a pre-PT, then I think I would have even done more work on the front end to really understand, what those settings did. Right now, I think I'm doing like what I would 100% love to do. I'm in an outpatient setting, and I love it. I love it because I'm seeing the full range from like athletes to neuro and all that. And we got a little Warriors fan. We got a Warriors fan, huh? Okay. That's all good. It's all good. But that's the biggest thing, Sarah. So great question. What about you, Casey?
Honestly, I'm probably like a lot of the students who follow us and listen to us. I just wanted to get in. And I was like, I can figure it out. I can figure it out after that. I can do outpatient. I can do hospital. And that's really the only two I really knew about. But I was just, let me get into PT school first, then let me figure it out. But honestly, if I knew this beforehand, I probably would have been a more attractive applicant because, like you said before, I would have been more knowledgeable and more impressive. And they'd be like, who is this guy who knows all about all these different settings? When everybody else just really knows about hospital, or you're going to go, outpatient setting. So I was just like, let me get in. I only knew about 2 settings and I'll figure it out from there. But honestly, you guys, all of you are now can set yourself apart, really. You're on the right track and you can go into campus visits, interviews, essays, and talk about something from a different perspective and a different viewpoint that can make you look more impressive. So congratulations. Congratulations on that, and take everything with you that we just talked about today.
For sure, for sure. All right, Casey, before we wrap up, give us a list of some non-clinical settings, with pre-PT grind being one of them, of course.
Oh, yeah. Pre-PT grind, number 1. You can really do whatever you want. Okay, so other professionals have non-clinical settings, and they're not really bashed or looked down upon. Like Dr. Oz, physician, he has a TV show, right? Dr. Phil, psychologist or whatever. He has a TV show. Like nurses are in management positions all the time, and they're not necessarily treating patients all the time. So we can do the same thing. You can be a department chair for a physical therapy school. You can be a professor. You can be a continuing education instructor. You can go into marketing. You can go into insurance. You can be on the other side. So you know how we bill insurance space. You can be on the other side of that. You can be a business owner, business consultant. You can make an app for, home health exercises. You can make a product. Like if you guys seen the neck hammock before, that was made from a doctor of physical therapy.
It's true.
He made that product. You can do the same thing. You can be like a medical device rep for like orthotics companies or something like that. You can be a recruiter for companies or schools, right? Schools market to us like, oh, come to my PT school. You can do that as well. You can do social media. You can do blogs. We just had a guy doing research yesterday on our podcast that one of our interns brought in that you guys will hear in the coming weeks. And then you can even get into politics, legislation. You can get into the APTA. You can advocate for us on Capitol Hill and all that stuff like that. So, I mean, there's really so much you can do. Just whatever you do, like don't limit yourself, really. Honestly, do not limit yourself, because that's another thing that attracted me to PT. After I did all that stuff, then I was like, wow, if I don't like this for a number of years, like Joseph said at the beginning, I don't have to get a new degree to go into business. I don't have to get a new degree to go into insurance, a new degree to go into marketing, social media, politics, anything like that. It's all right there. So that's another reason why I just love PT so much and why it's such a great profession. So that's the 2 sides, clinical, non-clinical. And check it out. Just keep your mind open and use all this information to your advantage. So,
boom. What's up, Anisabel? How you doing, fam? Good to see you. Yeah, guys, like we're wrapping it up. But at the end of the day, there are so many different avenues. You guys have heard clinical. You guys have heard non-clinical. Just know that there's still yet more to be discovered, and you guys are going to be the ones to do it. So never settle for what other people have built out for you. Always know that you guys can always push it further, and just like continue to just make this profession even more amazing than what it currently is. So know that, always serve at a high level. Y'all know we always trying to make sure that you guys receive nothing but the best. So make sure that you guys push to excel. Like always, as always, you guys can reach out to us at contact@pre-PTgrind.com. You can always reach out to us at contact@pre-PTgrind.com, where we can serve you guys at a continuous level all the time. We're always ready to answer your questions, guys. Like we said, we're not going anywhere. We're not going anywhere because we love physical therapy too much to let y'all go hanging. Does that make sense? You guys are the future of the profession, the future and present of the profession. So we love PT too much to leave y'all hanging. All right. So we're not going anywhere. We're always going to be here. Reach out to us at contact@pre-PTgrind.com. Let's make sure that you guys have an absolutely amazing process getting into your physical therapy programs, y'all. Let's get it. You guys have an absolutely amazing evening. Many blessings. Bye.